The focus today is talking about this big meeting everybody's been talking about. It's called COP26. And so we're going to get into that. Why is it called a COP? Why does it matter? To start us off, we're actually going to turn to Arthur, who's going to share a bit with us about if you get this webinar and you really feel like you want to learn even more about COP, the WHO has a series and Arthur's going to come and tell us about that.
Hi, everyone. My name is Arthur. I'm part of the WHO climate change team. And I won't take up too much of your time. I just quickly want to share another resource with you. As Jen mentioned, if this is a topic that's near to your heart and you'd like to learn more about the COP26 and the Paris Agreement and the history of the Paris Agreement, WHO and partners together with the WHO Civil Society Working Group have created an online course. It's completely free. That also provides you with a certificate at the end if you complete it. That gives you a more in-depth sort of overview of what COP26 is, what the Paris Agreement is, why is this important, why is it important for health. It's quite dynamic as well, so it's quite a nice course. We spent quite a bit of time on this. You can also follow the course at your own pace. And so I think it's quite a useful resource for those of you who are interested to learn more and also understand the terminology. For those of you who would like to follow COP26 a bit closer, I think it's quite a useful resource to dive into.
Thanks so much, Arthur. And with that, I'm going to pass it to Jess and to Yasin.
Thanks so much, Jen. Today we're going to be focused on COP, and we're going to be hearing from Yasin Cholikov, who's a public health physician in Canada and the chairperson of the Junior Doctors Network of the World Medical Association, and then a little bit also from me on COP26 and why it matters for health. We'll then have some time for Q&A before Yasin needs to leave us, and then we'll hear again from me, I'm afraid. But among all this, we would really love to hear experiences that others have had at previous COPs and advice you might give to others. So please be thinking of those as we go through. So briefly on what COP is. A lot of the material that I'm presenting today is actually from the WHO course that Arthur just spoken about. I can really commend that. I haven't yet completed all of it, but parts of it have been invaluable for preparing these slides. So if you haven't looked yet, you can actually just click through the PDFs and get a sense of which lessons would be most helpful for you to start with. But COP is the largest annual UN conference. It's attended on average by around 25,000 participants. COP refers to the Conference of the Parties, COP, of the UN Framework Convention on Climate Change, the UNFCCC. And a party is one of 197 governments worldwide that have formally signed on to or ratified the UN Framework Convention on Climate Change, which came into force in 1994. COP26 is the 26th conference since this date. And in addition to governments, COP can be attended by representatives from UN agencies, civil society, academia. These groups are classified as observers, and also the press. Observers don't have any official role in negotiations, but many do seek to influence the negotiations for better or for worse. And while the governmental negotiations take place, observers can organise and attend events and other informal meetings. In terms of COP26 specifically, it's taking place in Glasgow in the UK, although there will also be a virtual component, and it's from the 31st of October to the 12th of November. It will be hosted by the UK, but in partnership with Italy. Of course, every COP matters. To many people, COP26 is the most important in recent years. In 2015, at COP21, governments adopted the Paris Agreement, in which they committed to limit global warming to well below 2 degrees Celsius and preferably to 1.5 degrees Celsius. To reach these goals, they agreed to submit country plans, which would be updated every 5 years, setting out how they plan to carry out their fair share of progress. And these plans are called nationally determined contributions. By COP26, all countries are due to have updated these plans, painting a clear picture of where the world stands and what must still be done to ensure that the world remains a safe place to live. Despite a brief dip in carbon dioxide emissions due to measures put in place during the pandemic, the world is actually still heading for temperature rise in excess of 3 degrees Celsius this century, which is of course far beyond the development goals of limiting global warming to well below 2 degrees C and pursuing 1.5 degrees C. So hopefully by the time we get to COP, we'll have a clearer and better idea of what needs to be done and how big the gap is. In terms of how COP itself works, things are divided into very discrete physical zones. There's a blue zone where the international negotiations take place, along with meetings of political leaders and ministers, accredited officials, as well as official events. The green zone is much more accessible, much more open, and here there are exhibitions, country pavilions, campaigning and side events, and there are also usually other events around the city. One example of this is the Global Climate and Health Conference. In terms of what actually happens in the political negotiations, countries can choose to coordinate as part of a wider group if there are other countries in their group that share the same priorities, and this increases the weight of what they're asking. Some of these groups are the Alliance of Small Island States, which have shared priorities for very obvious reasons. There are 39 countries in the Alliance of Small Island States, AOSIS. There's also 49 countries in the least developed countries political bloc. There's the G77, there's the BASICS countries, Brazil, South Africa, India, and China. The graphic here is from ECIU, the Energy Climate Intelligence Unit, and it's part of a much bigger infographic, and that's also really useful. I'd recommend it. You can access the link after the webinar once the slides are online. At this point, I'm going to pass over to Yasin. Yasin is going to share a bit about his past experience with health sector engagement at COP, and then we'll have some short time for Q&A, and I'll be back again after that.
Thank you, Jess. As I was introduced, I'm currently the chairperson of the Junior Doctors Network of the World Medical Association. So most of my experiences at the international level, both in climate change space and the global health space, have been through medical professional organizations, be it the International Federation of Medical Students Association, IFMSA, as well as the WMA. So just keep that in mind when I explain things. I think it might have influenced my experience of those events. But first, to get us started on this, I think that probably in a group where there's more people from the health sector, and I think that I wanted to contrast what COP is compared to other global health meetings. I think it's important to recognize that at COP or at UNFCCC meetings in general, the majority of participants are not health experts, but they do have a lot of expertise in other fields like environmental science and policy, and are closely linked to the politics of their countries in those fields. This is important when thinking of how to conduct advocacy or how to engage in those spaces, because one must learn to speak the language of the land, so to say, and one must be able to translate the health concepts to the relevant elements that they map to into the framework that's being discussed at those meetings. And this must be a kind of an ongoing effort, because oftentimes what happens at those meetings is that we tend to speak to each other a lot, and I think that we can do more to speak to others. So who's there from the health community? I'll give you my personal way of classifying things. This is not science-based. It's just a neat way of thinking of who you're interacting with at different points in time. So there's the National Health and Climate Alliances. There's different groups from different countries that are going to be there, and they're composed of healthcare and public health professionals. And their work is focused mostly on climate change or sometimes environmental issues and health. So they're kind of the core. They always work on this. Then there's also international health professional organizations and groups. For those groups, usually climate change issues are only one part of their portfolio. Those are groups that sometimes function as unions, sometimes function as associations for their profession, but have an interest in environmental issues and in climate change, so they attend some of those negotiations. Then there's other groups that are not, I wouldn't call them the health community, but environmental NGOs, for whom certain parts of their work touch upon the topics of health and who are interested in that and then participate in those activities that have to do with health and climate. And it's important that one recognizes which group you're part of and what that kind of brings, and also who you're interacting with in order to make those interactions most fruitful, and to learn from those who are outside of your sector and may have more experience in certain elements that are valuable. Similarly, I think that when arriving at a meeting like that, you want to use certain advocacy tools that are on hand. Most of the COPs I've been to, we always end up kind of on the ground scrambling and building some more things, because you don't have the exact specific thing that you would like to have, and you make it. But you also have lots of things that are now, they're not like, if you want, canon. They always come out. They're recognized good tools for this kind of advocacy. And for those, I like to conceptualize them as the non-specific ones and the specific ones. And when I'm talking about specific, non-specific, that's what in relation to the policy issues that are discussed and decided at the COP meeting. So the negotiation. The non-specific ones, I would say, and I think you probably all have heard of them, know some of those tools. There's a Lancet countdown, comes out yearly, usually around the time of COP, and has a lot of nice data that's packaged together in ways that can then be used for advocacy. There's the WHO special report. A second one is coming out this year. There's been previous one that packages information nicely and is even a bit more targeted to COP than the Lancet. And lastly, there's very often calls for action from large health or public health groups. And those calls to actions are usually international, and they're signed by organizations and individuals, and they can be used as advocacy tools. The more specific things are things like policy briefs on the specific negotiations that are produced by health groups. So groups that have done that in the past, and I'm sorry for any that I missed, IFMSA, the World Medical Association, GCHA, HEAL, those are all groups that I know will often produce briefs on the specific topics. And those ones can sometimes be very good in meeting a negotiator and talking to them about that area of their own work, and they'll recognize what you're speaking about, and they'll be able to clearly integrate that feedback. And then there's policy briefs that are on negotiation aspects that are not from health groups, but where I as a health advocate, or you as health advocates, might recognize priority areas for you. So you can use those things and link them up with the health topics that you are the master and that the rest of the community there is less familiar with, and try to push certain issues forward.
I have a question about what it feels like to talk to a negotiator, because I know you've done that a lot. So before you move on, could you just say, we all run around, we chase down the negotiators, we have our briefs. What does that usually sort of feel like or look like?
I think the end answer to that is kind of feels like speaking to someone that you've just met. It can be a bit awkward. It can be nice and pleasant. It depends really on the context as well. So trying to find people at good moments in time is important. I think the key word here when comparing to other meetings is that first and foremost, COP is huge. There's tens of thousands of people participating. So finding the person that you're meant to speak to can be harder. Even the large public health and global health policy meetings are usually smaller than that. So that's important to keep in mind. Second of all, I mentioned it earlier, but the majority of negotiators are not going to be health experts. If you're lucky, the person, let's say the party or the country that you want to speak to will have a health expert, and that could be an interesting entry point. But chances are the answer to that is no. Or chances are that you want to speak about a policy issue that's not in the health expert's portfolio, even though you're bringing a health perspective to it. So I think that an important point to make on this is to focus on negotiation issues, speaking to negotiators, because that's their job. They're there to bring their country's perspective on specific issues. They're not there necessarily to learn about health and climate change. That's not the best moment. They're quite busy in general. You should arrive prepared to talk about a specific thing that you know that the person in front of you is working on, or if you don't know, ask them who in their team is working on that issue, so that you can then schedule a proper meet up with that person, and then try to speak their language. I think having that level of preparation shows professionalism, but it also makes it easier to get your message across. All of those things that I mentioned earlier, the advocacy material, you can try to bring those things along, try to bring things that are specific to the country. There's some of the advocacy tools have done country analysis, so you can try to pull out the stuff that might interest the specific person you're approaching. Yeah, I think that's it. And I think with respect to planning any advocacy or any sort of approach, I think it's interesting to think of why you're approaching a specific person. It's always easier if you have things in common, if you're approaching someone from your country or your region, or if you speak a common language, rather than just trying to speak to everyone you come across about the issue that you have to heart. I see the time flying, so maybe I'll go to one last point. I had notes on other issues, but maybe an advice for people who would be attending a UNFCCC meeting for the first time. I think it's crucial to try to understand the negotiations. COP, like I said, is very large, so you can easily waltz through the whole process while only attending side events, meeting people, all of which is interesting, but without actually engaging in the core policy making that's happening there. And I think that's important. That's the reason COP is convened yearly or so, is in order to try to move climate change policy ahead. I think in order to understand that, it's important to network. So firstly, people from the health field, because it's then probably going to be useful, or could be, that those networks you can maintain through time, and you can work on projects outside of COP, on projects that are related to climate change and health with those people. But I think more importantly, so even, is to network with people that are outside of the health space, people that have been around and following COP negotiations for a long time, that will be able to not only identify the kind of critical issues that are happening right now, but also talk to you about their history over 5-10 years of negotiations, because it's a process just described that has been going on since 1994. None of the issues that are discussed right now or that are critical right now are new. A lot of them have a very important history and a certain path dependency in the policy that's brought forward, and they're hard to steer in a different direction. So understanding that can give you a better insight on which levers to use to try to steer things. Otherwise, you're kind of the person who has a hammer and sees a nail and everything. I think everyone should develop their tool set a bit and be able to identify things beyond nails. But so much for that metaphor that I mangled up. So I think it's also one last thought on that. For if you're a first timer, COP is to tag along a well-organized group that has institutional memory and that has been going on for a while. So yeah, I'll close with this, and I'm happy to answer a few questions.
Thanks so much, Yasin. That's so informative and so valuable to get your years of experience. Do you have ideas about how people can engage if they're not attending in person?
So to give a history, I've attended numerous COPs in person, but I've also tried to engage when not in person, when I couldn't travel for all kinds of reasons. I think there's two things. First of all, if it hasn't transpired, I think I get most interested or most excited about following the negotiations and those processes, if it wasn't clear from my previous discussion. So to do that remotely, I think you must very much rely on people in your networks giving you information, and the kind of advocacy that you would do in such a situation would be through them. I don't think this is something very easy to do remotely. However, I think that a whole other area of advocacy that happens during COP is something that I could call non-specific climate change and health advocacy. And this is something that happens in and around COP physically, but it also happens all around the world at the same time. There's basically media turns itself to the topic of climate change, and it becomes much easier to basically have stories around that, bring attention to specific issues in your own communities. So that is something that you can definitely make use of. You can, those non-specific tools that I mentioned earlier, you can talk about them for what it means for you, the fact that there's more pollution in your city, or the fact that a new study came out saying that a certain proportion of childhood deaths are due to poor air quality, or that there will be more forest fires in your part of the world because of climate change, and that those issues must be addressed at a national or local level. So making use of that global focus on the issue during the 2 weeks that COP lasts is something that you can definitely do. And you don't need to basically be plugged in on UNTV and trying to watch snippets of COP here and there. You can do it independently and just ride the wave.
Thanks so much. Anyone else has a question? Now's your moment. Yeah, Arthur, go ahead.
Hi, Yasin. Thanks so much for that update. That was actually quite useful. Just as a last question, I wondered if you could share one of the most fun or one of the most memorable, gratifying experiences of COP that you still remember and that you take with you, just to also to share with people the kind of things that you could take away from COP on a personal level.
I would say I don't think it's a singular event, and I think it's probably happened at every COP that I've been to, but kind of towards the end, at some point, you've been with similar people. It's late at night, and you're around a table chatting for a final time to discuss what you're doing, what kind of strategy you're trying to accomplish something the next morning. And basically those moments, I think, are very fun, precious, or interesting, all of it kind of combined together. And then the next day, seeing how things go and seeing how those plans work out, usually never as planned, but still, and reflecting on it a few weeks later to see if some of the advocacy you did has had any impact. And I think it's presumptuous to say that, oh, well, I said this to this person, so that thing happened. But it's nice to sometimes see that you work on an issue and then the outcomes have kind of gotten closer towards the direction that you were asking for. It's the combined work of probably 1,000 people all around the world and at COP that led to that. But it's good to have taken part in that.
Thank you so much for coming in the middle of your working day to come share your experiences with us. We really appreciate it very, very much. I want to put Alice Cox on our team on the spot ever so briefly. We've got a question in the chat that is, are we planning anything globally? If you could share really briefly about what we're planning as much as you can. I know it's not public yet, and maybe just say a few words about what you know about what the pediatricians are planning.
Sure. Hi there, everybody. So yes, we have got things planned. The next of these webinars, we're going to be talking about it in some detail because we will have launched these activities more globally by then. But just to give you a brief idea, our intention, and we've been talking with other organisations about this, and they've been helping us to plan, is to have a sign-on letter that we'll be seeking signing on from health organisations and individuals around the world to take our voice to COP26. So that will be the main sort of mechanism, and you'll be hearing more about that very soon if you've not already. So we'll be talking about that at the next webinar. There'll be a launch activity around that colleagues at UK Health Alliance for Health Alliance on Climate Change have been involved in, but I won't say more about that because that is all under wraps for now until it's launched. We have been talking with, and there is a link I'll put into the chat in a sec. There's a group of paediatricians from the UK who are organising a bike ride from London to Glasgow to take the message about the concerns of the health professionals, and particularly in their case, paediatricians, about climate change. And that's kind of it, really. There's all sorts of things going on. So I'll put a link to the what's called the Ride for Their Lives initiative with the cycle to Glasgow. You'll be hearing more next time about the letter and the sign-on.
That's perfect. That we'll turn it back to Jess to just finish up the presentation, and then if folks have other questions near the end, then we're happy to answer those as well.
Thanks so much, Jen. So what's on the agenda? Health is not on the agenda as such, probably not an answer that many of us would hope for. This is obviously challenging, but it also reflects the fact that health is such a cross-cutting issue. It does mean, as the health community, there is great value to understanding the basics of some of the negotiation streams at COP and to consider how they relate to health. So I'm going to run through the 12 negotiation streams that you can see on the slide. This is also the slide where I really do need to credit material to the WHO online course. This is from lesson 5 for anyone that wants to read up after it. This is also the slide that I'll be spending longest on today, so please do stay with me. There's a lot more to do, and I think that this slide may raise more questions than it gives answers, but we have a good few months in the lead up to COP for the health community to fully understand some of the different issues that are being discussed. So the UNFCCC long-term goal, the ultimate goal of the UN Framework Convention on Climate Change, is the stabilisation of greenhouse gas concentrations in the atmosphere at a level that would prevent dangerous anthropogenic interference within the climate system. That's the text from the convention itself. A review of the extent to which this goal is adequate and progress towards it is underway, and part of this review will fall during COP26. So there's a chance here for the health community to call for inclusion of health in this discussion by highlighting the need for long-term commitments to ensure that global public health is not threatened. Response measures deal with the effects that arise from implementing mitigation measures, including cross-border environmental, social and economic impacts. This is somewhere that health co-benefits from mitigation in the energy, transport and food systems, so cleaner air, increased physical activity and healthier diets can be promoted and emphasised. In terms of carbon markets, international carbon markets refer to how countries that struggle to meet their emissions reductions targets under their NDCs or want to pursue a cheaper way to achieve this can purchase emissions reductions from other nations that have already cut their emissions more than the amount they've pledged, such as by transitioning to renewable energy. Carbon Brief actually calls the political priorities that surround the discussion on carbon markets as a veritable four-dimensional spaghetti. So there is no shame in not understanding everything right now, but the thing to really emphasize is that well-designed rules around carbon markets would be a big deal, both in terms of the potential emissions reductions and the cost savings that they can generate. In terms of a health-specific ask, the health community can ask for part of the income from carbon markets to be channeled to the adaptation fund, where it can support adaptation in the most vulnerable countries, and that, of course, includes health adaptation. Loss and damage refers to the results when climate change impacts exceed our capacity to respond. Health is usually considered as a non-economic impact under loss and damage. And from a health perspective, the work of what's called the Warsaw International Mechanism on Loss and Damage at COP should include the provision of new and additional finance for vulnerable developing countries. Adaptation is one of the areas where it's easier to see where health fits. WHO has developed comprehensive guidance on this already. It's especially relevant for the health community to be calling for health to be included within any technical support, guidance, and indicators that are developed to support parties under the adaptation discussions. As far as finance goes, only 0.5% of climate finance currently supports health projects. At COP26, the Finance Committee will discuss reports on the determination of the needs of developing country parties, as well as overall climate finance flows.
Oh, sorry, one second. Just say climate finance is this idea that wealthier countries should put money towards allowing adaptation in richer countries. So when we're talking about finance, it's like, who is paying for climate change?
Thanks, Jen.
No problem.
So parties will also discuss the goal of mobilising at least 100 billion a year in climate finance by 2020, which is what Jen just spoke about. And we'll start negotiating a new goal for 2025 onwards. And here the health community can promote the consideration of health costs and co-benefits across financing discussions. And this also relates to carbon pricing and the reform of fossil fuel subsidies and the gains that that would have for health and the cost savings there. For transparency, during COP26, reporting on the transparency framework will be discussed. The transparency framework is designed to build trust and confidence that all countries are contributing their share to the global effort. That will continue to be negotiated. So here there could be an opportunity to include health co-benefits, impacts, vulnerabilities, and other health aspects in the reporting of this framework. Agriculture, like adaptation, and the links between agriculture and health are something that is a little more familiar for the health community than some of the other areas that are on this slide. Healthy diets are usually more environmentally sustainable, while climate change itself poses a threat to food security. The word to listen out for here at COP is Coronivia, which is the name of a joint work programme on agriculture that recently concluded. Coronivia, incidentally, is the name of an agricultural research station in Fiji, so that's where the name comes from originally. Biodiversity, it's now also increasingly recognised that climate change, biodiversity and health are intrinsically interconnected. Climate change accelerates biodiversity loss, compounding associated negative consequences on human health and well-being. Meanwhile, healthy ecosystems make an important contribution to both climate change mitigation and adaptation, and to safeguarding human health. Discussions on gender are an opportunity for the health community to highlight how the health impacts of climate change are felt differently by women and men, boys and girls. And gender equality and health equity, of course, also play a key role in both climate action and public health goals. In discussions on Indigenous peoples, here a key ask is to conduct health and vulnerability assessments with a special focus on Indigenous peoples. And in terms of youth, ahead of COP26, Youngo, which is the constituency of non-governmental youth organisations that make up one of the 9 civil society groups represented in the UNFCCC, will organise its annual conference of the youth. Italy will also host Youth for Climate Driving Ambition in September, and that will be attended by over 400 youths. Today's youths are, of course, more likely to be highly affected by climate change as the years go on. And these two events will be an opportunity for them to consolidate priorities that are carried forward to COP26. So although health is not featured in the official agenda, it is covered in many of the side events. These are wide-ranging, and it would be possible to spend much of the week attending health-related side events. Although, as Yasin has already said, it's so important to be tapping into the negotiations wherever possible. In addition to the general side events, the agenda for COP26 is, of course, still being agreed, but the UK is hopeful that this will include a dedicated higher-level session on health. Yasin spoke about how the health community can engage around COP, whether you're there or not. Many of the members of national delegations to COP are often from the Ministry of Environment, Energy or Climate. In addition, other ministries are likely to participate, such as those responsible for foreign affairs, finance, industry, commerce, transport, agriculture, and happily also, in a number of cases, health. Provisional list of participants, PLOP, actually called the plot, is available a few days before the meeting, and the final list is published after. So this isn't hugely helpful for advanced planning, but you can take a look at the lists from previous years to get an idea of who attends for your country. And there's also a list of UNFCCC focal points available all year round, with at least one contact for each country. Those are linked in the slide, and the hyperlinks will be active once the slides are uploaded to the GCHA website. This takes us to our next activity, a slightly more interactive moment, which, Jen, are you able to talk through that?
Yeah, I can get us started. One of the things that we're hoping to do is get tweeting at your focal points. So what we're going to ask you to do is, there are these focal points, they're the chief negotiators for the countries at COP. This is what this slide looks like. What we're going to encourage you to do, we don't unfortunately have the Twitter handles for all your ministers of health or all your ministers of the environment, but if you are able to find somebody who is a decision maker, we are encouraging you to talk to any decision maker. We're inviting you to use the document that Jess just dropped in the chat. You can use either of these two tweets. So you want to make sure that if you copy paste this into your Twitter, you're going to replace your own country. And if you can, either add your Minister of Health, your Minister of the Environment, your Prime Minister or President. And we're going to encourage everyone on this call. There are 30 of us. So you can imagine if 30 people start tweeting at their health ministers, I mean, it's a good beginning. We're going to keep trying to build this and have an ongoing conversation. So take a minute, get out your Twitter feed, and you can use these tweets. You can copy your own. I found a Twitter list that is all of the world leaders. So what you want to do, I don't know that it's going to let me click on this because I'm not logged in on this account, but if you follow that link and you click this 199 members and you are logged into Twitter, you'll get a drop-down list of all of the leaders that whoever made this list could find Twitter handles for. Awesome. And this type of thing, it doesn't just have to be on this webinar. We encourage you to tweet at your decision makers from now until the COP. Again, it's going to be much more challenging this time for some people to meet with their decision makers because we aren't yet sure how many of us are going to be able to go, and COVID restrictions are presenting obviously a lot of challenges. So now is a great time to start engaging. All right, with that, I'll invite anybody on the call. One of the things we wanted to do is give people an opportunity to share what they're working on in the lead up to COP or are related to climate and health overall. So if you have a project you're working on, something that you would like the group to know about, we'd really welcome that, as is my way. I might put, Andrea, do you want to just briefly share at all about the Race to Zero work that Healthcare Without Harm is doing?
Absolutely. So hi, everyone. I'm Andrea from Healthcare Without Harm Latin America team. And sure, so Race to Zero, for those of you who don't know, is a campaign that has been promoted by the high-level champions on climate action under UNFCCC. These are basically two people, the position rotates with every COP, two people that represent non-state stakeholders in the UNFCCC process. and there's always one from the current presidency and someone else from the incoming presidency. So now we have someone from Chile and someone from the UK. And the champions have put together the Race to Zero campaign basically to put together commitments. It's actually the biggest global coalition of different stakeholders, non-party stakeholders, that have committed to reaching net zero emissions by 2050. So as some of you might know, the IPCC has basically told us in 2 reports now that the only way to keep to the goal of limiting global temperature rise to 1.5 degrees Celsius by the end of the century is to reach global net zero emissions by 2050. So this is how the champions are tackling it, by raising momentum through the campaign. And as of November last year, Healthcare Without Harm has become the health sector for the campaign. What this means is that any health system or institution that wishes to commit to net zero by 2050 and wants to join the Race to Zero can do so through Healthcare Without Harm. I'm happy to put in the chat where all of the information is and how you can do this and how you can, well, basically encourage your national health system and any health institution that wants to join to do so. And if I might, since I already have the floor, I might also add that the COP26 presidency has put together a health program, which is something that we are very happy to be contributing to. UNFCCC and WHO are also part of this alliance. And there's a couple of initiatives that we are asking governments to commit to. One is on climate resilient health systems, and the other is on low carbon and sustainable health systems. Thanks, Jen.
Thanks so much, Andrea. I really appreciate that. Thank you so much for joining us today. It's been great to have you.